After your surgery, the first few days will go by in a flash. You will be swarmed upon and you won't know whether you're Arthur or Martha. One of the issues that we've got is the domains of expertise. You'll be seen by nurses, pain specialists, rehab physicians, myself, my team. You'll be seen by pharmacists, and the most important person is the tea lady and the lunch lady, so pay special attention to them. The food here is fantastic. In terms of what happens each day, you'll notice that each day less and less tubes and drips are attached to you. That first day we remove everything except for an IV cannula, and importantly that epidural for the knee, that adductor canal catheter. If you're having a knee replacement, this is the main pain relief that we give you. It's that local anaesthetic that's delivered through that tube. If you're lucky enough to have a hip replacement, there's not many lines in, and we remove almost all of them on that first day. So you're up and in your normal clothes really on that first day.